girls, so this is really a rough and quick video to try and talk you through visually what we're doing on a treatment day, okay? So I'm going to do as best I can. I am really tired and it's been a long day and I'm sweating, so bear with me, but we'll give it a go together. So you come in your normal, you'd be in your normal outfits. You come in and you wash your hands first. So hands are then washed. You then proceed into surgery 3. So remember girls, jewellery, you're allowed only a plain wedding band and nothing else. So any engagement rings, earrings, any necklaces, all have to be left in your car. So just your plain ring. It is on here, all the instructions for that. If you do have a plain wedding ring, you just have to make sure you take care of it when you're drying. So then you would go into surgery 3 and your scrubs. Pick whatever scrubs will fit you. They are then your scrubs. You come over to here. You've got your nurses, dentist, a reception box. Any clothes that you are wearing or any belongings, handbag, anything like that, keys, phones, all get left in this box, which is where my clothes are now. And you get into your scrubs. Your shoes would be left here and you would have your Crocs to put on. So as you leave this room, you'd be completely all in your gown, all in your scrubs, and everything that you've come in with is left in that box. Make sure your hair, again, all the instructions are here. Make sure your hair is tied back, ready for the day. You would then go upstairs to the waiting room and have the meeting with, we'll say John, you'd have your meeting. Girls, make sure you ask John what it is that he plans on doing with the patients. You talk about what you're doing that day with the patients so that you know exactly what instruments you need, exactly what payments are being taken, what appointments might be made. You need to know everything in that meeting. Okay. Pause. Okay, so you've had the meeting, you know what you're doing. Up the stairs we go. You would open this window, get the airflow going, and we're going up to the decon room. I hope you girls appreciate I have gone up 3 floors for this video. So up we go, come on Kirsty. Woo, fitness. Okay. So we're in our decon room. Always, we've entered a new room. We need to wash our hands again and then gel them and set up for the day ahead. So just like normal, we've set everything up, get anything you need, okay? You will need some sterile water because we need that for the mouthwash. So if you want to make sure that that's, oh my gosh, filled up for you. So you finish everything and get yourself a cup of mouthwash, of sterile water. I'll explain that, that will be explained over in this, because basically with the mouthwashes we've got, you need 5 ml of the mouthwash, 10 ml of sterile water, and you need to mix them together then in a cup for the mouthwash. That is in here though. Anything you're confused about, just ring me. So we then go down to the OPG room. Oh, we got a cheeky Sean. Pee, I need a pee. Right girls, so we then go to the OPG room, or Donning and Doffing room, where you would get your, which is in here, bear with me. This box will be in this room, okay? This box, you would put everything and anything in it that you think, because you've already talked to John, so you'll know what you'll need, but put everything and anything that you think you'll need or you know you need into this box. So I have got in there, I'd have x-rays, x-ray holders, burr block, cons kit, fast handpiece, slow handpiece, bit for the Reliaxes, light cure, mouthwash. I'd have my syringes for the mouthwash. Micro brushes. Basically I've set everything in here that I think you might need, even down to floss and covers for these. And your bits obviously there. and that would be you set for your session, your morning session in that box. So there is no need for you to then need to go in any drawers or any cupboards. All your stuff is in here labelled. So we've got all of our PPE there. This is non-treatment days. Our gowns for treatment days. Surgical hats. Gloves are now in this cupboard because we've run out of room. So you've got gloves in here. We got an extra mouthwash here, masks, rubber dam kit, everything, visors, aprons. It's all in this room, okay? So then we would then go and set up the surgery. So you come in, open the window, get your PPE on, so your gloves, and clean the room, get the room cleaned down. So that's all ready now. So you've done everything. You've asked John if he needs anything else. Basically everything's ready. The patient's arrived. You then go and gown up. There's instructions to follow for gowning up are on here. Okay? So you've got what to do on your treatment days and your non-treatment days. Follow these. I've even put the x-ray procedure if you need to do an x-ray, but you shouldn't need to do an x-ray on a treatment day. That's for non-treatment days. Okay, girls? And then when you're finished in surgery, so you've done all your treatment, you're all PP'd up, you've finished your treatment. You put all of your dirty instruments into your dirty box, which you would have brought down with you from the decon room, and you shut the lid and leave them there. You leave everything. You come over, you shut the window, make sure that, you clean your gloves first, so alcohol gel. Shut the window, so that just leaves your air purifier now to do its job. You leave the room, come here, you would degown. The degown instructions are in there as well, so you would have already read that. And you have this bin, so when you know you're doing treatment, you've got a trolley coming, at the moment it's a bin, have the bin outside surgery there. You would take everything off into that bin, all your gowns into that bin, your face mask and that you've already taken off in the room. And then leave that, you then leave the room. You'd write on the time that you left the room, so you've done, so say this is a treatment day, so here's the treatment day one. You'd write, 12 o'clock you left the room, 1 o'clock it's safe to come back in. You put do not enter on that door, so that room is left for an hour now. You do not enter that room again for an hour. You would go into the opposite surgery to do any treatment you need to do. Instruments would be washed out or put through the sterilizer, the autoclave after every session. So good luck. I know this is just a bit mind-boggling and I've kind of thrown it all at you. I will do a proper video next week, but today time has just run away with me. And I'm sorry, but good luck, you'll be absolutely perfect. And last but not least, girls, your scrubs, at the end of the day, you have to take them home with you, and you all know that you've got to wash them on 60, but yes, they go home with you that day. And anything else to tell you? No, you can't use any of the cutlery here. So any of things like that, you can't use anything, bring in your own stuff, and that also has to go home with you at the end of the day. Okay, so see you soon.